Hi, this is David Rosenberg for the Psychopharmacology Institute. In this Child and Adolescent Psychiatry, or CAP Smart Take, we're going to take a close look at the role of risperidone in the treatment of children and adolescents with anorexia nervosa. And this is an important understudied area because we know that anorexia nervosa is actually the most lethal and deadly of the psychiatric disorders. Its mortality rate is higher than that of schizophrenia and other psychiatric disorders. So the need for better treatment is clearly critical. And what's more is there's currently no FDA-approved medication for anorexia nervosa in either youth or adults. So this type of study is absolutely critical to see if we can get a better handle on treating anorexia nervosa. And at least in some, anorexia nervosa can be very difficult to treat, with relapse being the rule rather than the exception. And there's some evidence to suggest that early onset anorexia nervosa may have a poor prognosis and outcome, again, underscoring the need to look at other treatment options in this population. And so what this observational naturalistic study did was to look at 120 patients with anorexia nervosa, 42 of whom were treated with risperidone, and it was used for an average of 116 days. It was very well tolerated, with nausea and asthenia seen in one case. But overall, the results of this study were disappointing, to say the least. So despite it being well tolerated, there were no significant differences in terms of admission, discharge improvements for body mass index, or any of the psychopathology measures for children and adolescents with anorexia nervosa treated with risperidone versus those who were untreated. The retention rate shown in patients with risperidone at 3 months was 50%. At 1 year, it was only 9.5%. And it was mainly discontinued for resolution of target symptoms. That being said, rehospitalization at 12 months was comparable for children and adolescents who were treated with risperidone as compared to those not treated with risperidone. Now, what's impressive with this sample is this is the largest sample described in the literature to date, but it points to a clear need for longitudinal studies and assessment prospective studies to assess the long-term prognostic factors and tolerability. And there's a great need to compare this population with broader samples. Only 42 of the patients were treated with risperidone. We have to control for other treatments, other behavioral treatments. Comorbidity is a big issue in this population. Duration of illness, onset of the illness, as well as a host of other critical factors in this population, both physical conditions associated with anorexia nervosa, illness severity. So in many ways, this is an important study demonstrating tolerability, but in terms of efficacy or lack thereof of risperidone, it really raises far more questions that it answers at this particular point in time. It is the first to assess the use of risperidone in hospitalized children and adolescents with anorexia nervosa, but it does raise questions about the true efficacy of risperidone, which is not uncommonly used for a number of conditions, including eating disorders in child and adolescent psychiatry. The anorexia nervosa subtype is intriguing because we know the atypical antipsychotics, such as risperidone, can have significant weight gain side effects, which more often than not in other populations is a side effect we want to avoid in anorexia nervosa patients, it can be intriguing to study because weight gain is something that we're actually targeting in pediatric patients with anorexia nervosa. That being said, remember that the second generation antipsychotics are also associated with carbohydrate metabolic abnormalities. And while weight gain would definitely be a positive in patients with anorexia nervosa, exposing them to an increased risk for metabolic syndromes, metabolic abnormalities, carbohydrate abnormalities, diabetes would not be. And that's something else that really has to be studied in this population. What are the short and long-term risks for these types of abnormalities? Realize also that there is data in bulimia nervosa that bulimia can increase the risk itself for diabetes. So again, this is an important, fruitful area meriting study. What I think the take-home point here is that risperidone in children and adolescents with anorexia nervosa does appear to be relatively safe, well tolerated, but at least in this particular study, it didn't show any significant difference or improvement in weight gain, psychopathology, rehospitalization, body mass index. So at this point, it's hard to recommend risperidone as a potent or effective medication in this population, with the caveat that future longitudinal and prospective studies are really important to identify subpopulations' potential predictors of treatment response or lack thereof, and longer-term safety analyses and the risk for other side effects that are associated with these medications, particularly in terms of metabolic abnormalities.